Hello, and welcome to another episode of the Healthcare Executive Insights podcast. My name is Elliot Sloan with the Macallan Group, and today we have a very special guest, Miss Patty Post, the founder and CEO at Checkable Health. Patty, thanks so much for taking time to chat with us today.
Thank you for having me as a guest, Elliot.
Oh, it's our pleasure. So, Patty, tell us a little bit about your professional background and what led you to create Checkable Health.
Well, I'm a gal that carried a bag for years. And if any of you have carried a bag, you know what that means. That means that I sold capital equipment and disposables in the health systems. And I then moved to a clinical research organization where we worked from everything from biocompatibility through consulting to preclinical research and even post-market surveillance and studies. And then before I started Checkable, my last bout was consulting with med device companies that were looking to create their positioning and messaging for physicians as well as direct to consumer campaigns. Worked with technologies in digital health, but as well as medical device. But it was as a mother of three that I was determined to solve the problem of having to go into the doctor to check for strep. I had three kids that were really plagued with strep. And if you have ever had strep, you know it's highly contagious. It's a bacterial infection that usually when one kid in the classroom gets it, about 50% of the rest of the class gets it as well.
Wow.
So my kids there would be one down on Monday, and then we'd be in again on Wednesday and then on Thursday. And sometimes I would get it. So after about a year of having that struggle, maybe a little more, I was sitting there at the Minute Clinic, and it was literally the third time that I had been there. And I looked over as she was running that rapid strep test, and it dawned on me, this is just a very simple lateral flow test. Why is this not available at home? And my daughter was extremely sick at that point. She went to school that day, but the boys had been sick earlier in the week. And I looked it up on Amazon, and they were selling rapid strep tests. And it was from a medical distributor, and they were using the same test, distributing a Macallan test. And so I bought it, brought it to my house, and I started diagnosing my kids. And then I started to use telemedicine, and then I would get a prescription. So I sort of created the model at home, and then I gave it to a friend and gave her the instructions. And she said, I have no idea how to even read this. And it's because it's meant for a clinician to read the instructions, run the test. It sort of looks like a little chemistry set. So what I did was I created some videos and had some parents come over. I kind of was known as the strep lady in our elementary school. And so people would text me early in the morning, hey, Patty, I think that Rosie has strep. Can we come over and will you diagnose them?
Wow.
And so I started to do that, and here I am.
And I think it's so true. The most successful businesses and startups are the ones who are solving their own problems.
Yeah, I agree. You end up getting sort of, it sounds weird, but infected by it, and you can't think of anything else. And it's sort of like that entrepreneurial bug that you get. And I think when you're solving a problem, you're so bound and determined to find the solution and bring it to fruition, bring it to the world, because no one else has done it.
Sure. Now, was this concept created pre-pandemic?
It was actually. I had a hard time raising money. My first angel round, I had $495,000. There was a couple before me that had tried to do an at-home strep test, more molecular test. They weren't using lateral flow in the Minneapolis-St. Paul market. So that was challenging for me. And people would say moms would never change their behavior from going into the clinic. They will never collect a sample at home. This isn't going to work. Well, then come March 15th of 2020, I'm getting text messages. How long until your test is ready? Well, now it's stopped. I mean, clinical research, except COVID, stopped for about a year and a half. But,
sure.
It was it's pretty funny how that changed so quickly that people wanted the at-home strep test once COVID was here.
Yeah, I'm sure there was parents lining up at your house.
Yeah, yes, they were. And then I said, go buy your own test. And it is hard. I mean, those tests are still available on Amazon and we can't trust them really because a lot of them are expired.
Sure.
But I do recommend that if you're going to buy one, have it at your house and you train yourself and learn how to collect a sample and run the test. And then at least you can screen at home.
Yeah, I think for your business model, the pandemic has actually shifted the consumer mindset of, I actually want to do everything I can to stay out of the hospital. I want to do everything I can to stay out of the urgent care. I want to do as much as I can at home. And if that means learning how to do a test at home, I'm going to figure it out.
Yes. Well, yeah, we just did some research, actually, consumer research, and 502 parents took the study, and that was the number one reason why they wanted to have access to an at-home strep test, was to avoid just being exposed to other communicable diseases in a setting of a healthcare.
Sure. Yeah. And talk to me more about your philosophy that you mentioned to me, that the best healthcare begins at home, not at the doctor's office.
Mm-hmm. Well, I really think that if we are empowered with information, we feel confident, we take our health seriously, and we're empowered to do that ourselves and not relying on others to do it for us, that we are going to have a healthier home, whether that's, buying healthy groceries or access to recipes that are healthier, exercising, but then knowing what to have in your medicine cabinet, knowing how just healthy routines like going to sleep at a good time, having a good structure in your home that makes for good habits and discipline. That's just very basic, but that's a healthy way of life.
Well, you say it's basic, but what would be your guess of how many families out there, what percentage of them have healthy habits?
Well, unfortunately, I would say it's less than 50% of homes have healthy habits.
I would agree. I would say I'd be happy to hear more than 40%, 30%.
Yeah. And unfortunately, I do think that a lot of people, if you don't have an appetite to be healthy, then it's, you can lead a horse to water. You can't force it to drink, sort of thing. When it comes to the strep test, I think that looking or any type of diagnostic that you have at home, to be empowered to diagnose those symptoms from home and not having to run into a clinic. That's where that's wrapped in that your healthcare begins at home too, because healthcare isn't just around the four walls of the hospital. And that's what our healthcare system has been used for, is that when we're sick, we always run there. Oh, well, they're going to make me better. That I have to go see the doctor because they can tell me what's wrong with me. I mean, you just had said that your daughter Rosalie has RSV and has a wet cough. Well, what are some things at home that you could do? Is there a steam shower? Are there some aromatherapy things that you can do at home? I mean, those are things that your doctor will definitely tell you, but if you even just know some of these things, you can probably do them quite easily.
Well, it's funny you say that, because this is the second time my two daughters, I have, she's now 1.5 and the other daughter is just turned 3. Mm-hmm. Second time they've had RSV. The first time they had RSV, they were even younger. My youngest daughter was maybe 6 months old. Yeah, it was probably about 6-7 months ago. And my wife and I, just to be extra safe, we said, let's just go to the ER. It was a weekend. The urgent cares were closed. So we went to the local community hospital. We went in. Their coughs were nasty. They were not sleeping. One of the ER doctors said, listen, it's going around. There's nothing you can do. All you can do is fluids, monitor their temperature, and just get as much rest as you can. And here's a popsicle. I'm going to give them each a popsicle and send you guys on your way. A month later, I get a bill for $1,200 per child for a popsicle.
Right.
$1,200 per kid. They didn't do anything and we were in and out. It's like if they took blood work and if they gave them oxygen or did anything, I would understand. But it was literally, here's a popsicle. You're fine. They're going to be okay.
And I don't blame you, because it is very scary, especially when they're not sleeping and you're exhausted, and you definitely want them to feel better faster. But you probably learned your lesson that only takes one time to be like, okay, I know what to listen for. I know that they're better in a couple of days, and we just got to get through it. And unfortunately, it comes at a cost of $2,400 for you. But those, when our kids are, I'm a big believer of the otoscopes that are at home as well. I think it is more challenging to recognize if you have an ear infection versus fluid versus just an agitated eardrum. But I think that those are great options as well. And any of the remote patient monitoring devices that, I mean, they've been out now for years, and we see the insurance companies adopting them and our employer groups, that I think that we'll see costs drop and people are empowered by knowing that information. Even a blood pressure cuff at home. I mean, just knowing what your baseline is, your Apple Watch, things like that, I think is where our healthcare does begin at home.
Yeah, digital health is the future. So how do you see families across the country adopting digital health technologies? What do you think will become a norm in every home?
Well, like for us, we have a couple of apps that we use, like vitamin apps are something that we like to have. And I mean, this isn't really health, but even like a Duolingo, just think of like, okay, how are we working our brain every day? I know from our telemedicine, we use our telemedicine app a lot more than I would just, go into the doctor. As well as I look at even having access to my blood work that I get done once a year. And I like to see, what the baselines are. There is a great app that is, I haven't used, but my son had night terrors.
Wow.
And it was scary because you can't wake them up out of it when they're in their night terror. But what you can do with this app is it comes from the Apple Watch. And as they see you moving and getting restless, it can gradually wake them up through the vibration of the Apple Watch.
Wow.
And then get them out of their night terror. And then it will show track, when they had these night terrors. So then you can look back at, well, when is it that, was it something in their life that happened, or are there things happening at school? Those are technologies that I think are very specific and to a niche, but wow, can it make a difference in someone's life?
Sure. How far away do you think we are from everyone wearing some type of device that, whether it's a watch or some type of wearable that signals emergency when you have a stroke or a heart attack, signals the right appropriate provider if your vitals are not correct in a dangerous level? I feel like that could be right around the corner.
Yeah, I mean, I definitely think it could be. Unfortunately, I think it's still the cost that it's going to, who's going to manage that? I mean, healthcare makes money when we walk into the hospital. So what is that business model there? I would love that. I mean, for my parents, I know they're 81 and we pay for a service for them because my mom can be a little bit clumsy now, and we monitor her. And then my dad has AFib, so we have a brand new iWatch for him, but it's really expensive. And I even think, well, how is this going to help him? But we do look at that data, and he does show it to his provider. I'm not sure what they're doing with it, but I think there's a lot of opportunity there for sort of the concierge. Think of One Medical, and like, what's Amazon going to do now with One Medical? I think that's going to be, I think that question you just asked is perfectly suited for a One Medical, not for the healthcare system that's down the street from you.
Sure. But you would think insurance would be driving these initiatives. They want preventative medicine more than anyone.
Yeah. I just think they're a little slow at coverage and how to put it all together because they have such archaic systems. Like, I'm just a big believer in cash and fee for service and just paying cash. I wish I didn't have it's obviously not more expensive than what I pay my employees, but boy, as a startup with 11 employees, healthcare is my number 2 cost in the company.
Sure.
And we're a very young, healthy company too. Yep. So that's frustrating. That the healthcare, would it be better to do like a direct primary care service where you have sort of a nurse practitioner on demand and you can go down the street to get checked anytime? I think that model, we're going to see that grow significantly. You probably have on the East Coast a lot.
Yeah. I mean, you're seeing a lot of specialties starting to offer direct cash services. Mm-hmm. I mean, and for young, healthy people, why would you spend $500 a month to then never hit a $5,000 a year deductible?
Right.
Why would you do that?
Yeah. It doesn't make any sense at all. And just to have insurance for the catastrophic times, that's why we do it, right?
Yeah, that's it.
And you hope that never happens, but it's incredibly frustrating financially.
Until you have kids, then you said, okay, we need the best policy we can get.
Right. And then I think that's why when I was saying we utilize those 4 walls of the hospital and we're going into, okay, what's wrong with me? Just tell me what's wrong with me. I just want you to make me feel better. I think a part of that feeling comes from, as a parent, how much we're paying for this. Well, if I'm going to pay for it, then I'm going to utilize it. That's sort of the mindset, right?
Absolutely.
It's like when I had I have a son going to college and paying the dorm meal plan. Well, you're going to eat in the dorm 3 times a day because I pay for that dang meal plan. Don't go out to eat. Yeah. It's the same thing with our healthcare. So I think that needs to be changed. And, Romans has like an at-home testing kit that they purchased a company just this last summer that is at-home testing, rapid testing, and even like a Everly Health, those types of testings where inexpensive and you can do it pretty frequently. Sure. I think payers are starting to adopt those models.
Sure. Yeah. With the Romans and the Hims and the Hers coming to the market, insurance companies got to pivot.
Mm-hmm. Yeah. Right.
It's good to see a capitalistic market actually fighting back against the juggernauts in the room.
Mm-hmm. Yeah. I think the hard thing is, if you need a knee replacement, you can't go anywhere else. Or a spine surgery is mentioned, but I loved what you were saying about neuropathy. I mean, I think that there's a lot of different things that chiropractors have been fighting this forever, right? Like how are people going to trust us? And it's a lower cost of care, but it still is out of pocket. There's a lot of mind shifts that need to happen in our culture when it comes to healthcare.
Yeah, I think the biggest problem is waiting until you're chronically ill to get healthy. Yeah, I think that's why we see a big shift in functional medicine and dialing in your body and your hormone levels and your pH levels and your very specific diet and mandatory movement and exercise and meditation and mindfulness and tying it all together. The people who commit to those live such happier lives, let alone healthier lives.
Yeah, that functional medicine, I don't know about you, but so I had Dr. Keneally on my podcast, and she's out in California. She's very well renowned. She's published a couple of books. And after Cancer Revolution is her most recent book. And after I had her on, I started looking at functional medicine physicians in my area, which is West Fargo. And then I went to where my mom and dad are, which is rural Minnesota. And then I went down to Minneapolis, St. Paul, where I'm from. And really, there's not that many. And I think that's a really hard thing, is that I hear that I want functional medicine. I don't really know what it is or why I need it. How do I find that type of provider? And will my general practitioner just give me the same information? It's like a lot of education. I think insurance companies can do a much better job of
supporting it.
Yes, exactly. Yep. Through education. The hard thing is, I think we don't really read those brochures that come in from our insurance company.
Sure. Because you think the insurance company is always trying to confuse you.
Yeah,
so you said, I think
they are.
The more I read, the more confusing it gets. So just put it away.
Yes. That's what people ask me about reimbursement for the strep test. I'm like, it's going to be $29.99 for 2 tests. Like, I'm not dealing with any reimbursement. Just you're going to buy it out of pocket. I don't even have it on the shelf for when you need it.
The amount of time you'd spend to go to the doctor, sit in the waiting room, get seen, to get a prescription or to get a strep test, and then your $25 copay. Yeah. Wasted 2 hours of your life. What is that time worth to you?
Totally. It's an average of 4 hours.
4 hours.
For a positive, because then if you have to go to the pharmacy, then another trip to the pharmacy. I agree. I think time is
one thing we can't buy.
Everything. Yeah, we'll never get it back. And it's not time. I say it a lot in my pitches, is that, okay, so it was negative. Well, stay home and snuggle. I mean, really, if your child is not, they still have symptoms, they still have a fever, we'll keep them home. But wouldn't you rather stay home and snuggle than sit at the doctor's office for 4 hours and get them in the car with their pajamas on and blanket? And no one likes that.
That's an interesting thing you touched on, which I'm kind of in this point in my life where the kids are starting to go to school. And I'm always talking to my wife, like, at what point do we keep them home? Because some parents are like, well, everyone's sick at school. They just have a little runny nose. They need to go to school. Where do you draw the line?
Yeah. Well, this is my husband and I's argument. It's part of the reason why I started the company, because my husband should wear a shirt that says "rub some dirt" on it, because that's that's how he thinks. And, but if they have a fever, they should stay home. There's something that's not making them feel good. Those runny noses and a cough and, eye boogers and stuff. That's just unfortunate. Kids are kind of gross, right? But when it comes to strep or COVID, when you think of having a fever, they don't feel good either having a fever. So they should stay home. They'll recover faster.
Sure. Yeah. The temperature is a good sign of how severe it is.
Which a lot of parents don't have at home either, or they don't have an accurate thermometer. And that's something that we're looking at now is, should we have a thermometer that then will connect with our app? Because we have a native app as well that will connect to telemedicine, but we'll have like the vitamin tracking. We'll be able to have your family care plan. So you, your wife, your daughters will track all of that information. So if they had strep in February and then you log back in June, we'll say, oh, well, you just had it a few months ago. So we have that as well.
Wow. So through your app, you will have telemedicine services with providers that are internal on your team?
No, we are using a third party for our telemedicine.
Got it.
Yeah.
And is this a subscription model?
It can be. We are just doing one-offs as well. As we get more diagnostics, we're launching a UTI test and then a rapid vaginal pH test in January of this year, and then telemedicine as well.
Sure.
So we're still building out what our cost structure is for subscription versus just fee for service, a one-off. It is so affordable. I mean, to have a telemedicine versus not. And there's so many different things that you can be seen for. I mean,
sure.
I even think of mental health and
so important.
Right. And just access to that. I think, like I was saying before the call, I'm joining all of these moms groups. And it really, I think mental health, what I read a lot about is just lack of access to care. And to have that virtually and in your home, I think we just need more awareness that it is accessible to everyone.
Tell me more about other products. I know you have some apple cider gummies, some urinary tract balance supplements. What are your most popular best-selling products?
Well, our UTI Prevent supplement is our number one. That's a cranberry and D-mannose supplement with hibiscus. That by far is our bestseller, along with collagen.
So that's a preventative supplement. Sorry to cut you off, to prevent urinary tract infections. You don't take it once you have it.
Right. Well, once you feel any symptoms coming on, you can take it. And
Sure.
You can take it for an extended amount of time. Really, with that supplement, you shouldn't be taking it for like 3 months at a time because your body will just get used to it.
Sure.
But that cranberry, having it in that form is, I mean, that's been the people drink cranberry juice if you feel a UTI coming on, really is laden with sugar. This is the cranberry with the D-mannose that will help push that any infection out that you have. But it's very good for your urethra.
Got it. So it started with the strep tests and then you moved into supplements.
Yeah. I mean, really going to that, your healthcare begins at home.
Sure.
Looking at how are we we're going to diagnose your health. We're going to, or diagnose with our rapid diagnostics. And then how can we prevent any health episodes from happening, and how can we optimize your health? And in the optimize your health, that's a category of supplementation.
Sure.
And I think there are so many supplements out there. I'm happy with this 5 that we have right now. We're looking at adding 3 more in the beauty line as well as probiotic.
Okay.
And then moving to add a few more diagnostics as well. I mean, this supplement game is so big. It's a $42 billion market right now. I mean, look at all of these supplements coming out. It's insane.
Yeah.
And I wanted something to introduce to our customers, introduce the Checkable brand, and bring them into our company as a wellness, start your wellness journey with us.
Sure.
And then incorporate our diagnostics, as well as we have media, we have podcasts, we have our blogs. We're now starting events and just wellness events.
Sure.
We have one next week called Mocktails and Moms. And it's just moms get together, talk about kids,
how to stay healthy,
family, how to stay healthy. Yeah.
Sure.
And true to my alcohol free, hey, we're going to show you how to have some good mocktails.
I love it.
Yeah.
That'll speak to all the pregnant mothers out there.
Oh, for sure. We do. With the pregnant mamas like it. We like our recipes. We have Mocktail Mondays. We do it on our TikTok and Instagram, and those do really well, actually.
I believe it. So tell me more about bringing new products to market, the challenges you went through with clinical studies and FDA approvals, as well as fundraising. Mm-hmm. You know, for the startup companies in the med tech space or any type of healthcare product, what experiences or advice can you share on the side of getting products approved, and then also getting the capital to bring it to market? Mm-hmm.
Well, the great thing about supplements is that you do not need FDA approval. You find suppliers that are high quality, and you can brand them, get them to market, and then you have revenue coming in the door, which is why we had the supplements as well. So from the medical device side, anything regulated by the FDA, my number one is always find a good clinical strategist, find a good regulatory strategist. If that's not someone that you can hire right away, partner with someone that will give you your path to approval. And so you have a clear understanding of okay, what are your barriers? What are you up against? Is it what path are you taking? And as basic as what class is your device? And then from there, always fundraise 2x more than you think that you need, because it's always going to take more time and more money. Your trial will never run as fast as you think it will.
Sure.
From the fundraising standpoint, I'm actually giving a pitch this afternoon to a group. And I think when you start out, you just need to be everywhere and pitching as many places as you possibly can. If that's the accelerator programs, the pitch competitions, and get in and do your research, Crunchbase, see where the investors are, and pay for that high subscription, because that makes a huge difference. See who's gone into some of these early stage companies that are like yours, and start compiling a list. I think from two things that I learned was, start your list early, your list of like your wish list of who you would like to have as your investors, your list of who you've reached out to, then your list of who you've actually pitched to, and then another list of what are the questions that you've been asked. And then, keep adding to that list every time you pitch.
Sure.
Put those questions on that list. Because by the end of it, you should know how to answer every single one of those questions like that.
Sure. With practice comes mastery.
Yeah, absolutely. I think also the other thing with pitching, when you have it, whether it's I'm just closing on my seed too, and it was the first time that I put my pitch together and I didn't change it once until I had my last commitment. And the reason I did that was the times before, after every pitch meeting, I would adjust it. Oh, they asked me this question. Oh, I could have done this better. But then I never really knew, what was hitting and what wasn't hitting, because
too many variables.
Yeah. Mm-hmm. And I mean, investors are investors. They want to know what their return is, how fast it's going to hit, what's your business model, who's your team.
What do you think was your secret sauce that really stuck with your investors?
I think it's the same reason why I did well in sales. I think I'm a genuine person and I connect with people. And if I don't know the answer, I'm going to say I don't know the answer, but I'll come back and do my research and tell you what that answer is. Not
only was the branding and the model exciting for investors, but the leader is who they're investing in.
Yeah. And that also was it's why I didn't get investment from a lot of people, because I had never brought a product to market in this area. I've never gone through the FDA, led a company myself. First time CEO is really hard. And looking back, I was, kind of had a chip on my shoulder. Like, why would you say that? Well, because you've never done it before. It's like being a first time parent versus when you have your fourth kid. It's totally different.
Sure.
Or with anything, as well as I didn't have a co-founder, and I don't want a co-founder. I think a one leader company is really good. I think bringing the team together and having it be our culture at this early stage is really good for me. I can't say how others do with it, but from my experience, me being the solo founder has worked really well.
Yeah, you're on a path and nobody is slowing you down, and you're more determined than ever.
Yeah. Yes. Yeah. We have 18 clinical sites. We'll have them up and running by the end of this month.
Wow.
And so we're enrolling our goal is to be the first at-home approved rapid strep test. Okay. So meaning a lay user can collect a sample in their home, not in a clinic. Right now, a strep test is CLIA waived. So this would be just like any of those COVID tests that we see that the government's giving out, or Abbott had Bionics approved. Those are all OTC cleared, and that's our goal, is to have it OTC cleared. You can buy it at your pharmacy or on Amazon.
Sure. Now, do you see your website being your number one seller as far as e-commerce goes, or are you looking to have other platforms selling your products as the main driver?
We'll do, so we will be digital first, just as we are right now. We don't have anything in retailers. We will use any retailer that is online, as well as our e-commerce site. There's different strategies to get them to come to your site after they've purchased the first time. And we definitely are. That's another reason why we started with a supplement program, is because we needed to learn all of these different strategies. What's the consumer behavior? What do they like to see? How do they change from going from an Amazon to our website and then subscribing?
Sure.
So learning all of that prior to our big launch, which will be once the strep test is approved. And in my mind, that will be in fourth quarter of 2023.
Okay. It'll be here sooner than you know it.
Yes, it goes by really fast.
It's been, once we were allowed out of our homes, it seems like time is traveling faster than it ever has.
Yeah, I know, right? So if you're in New Jersey, you're in Hoboken, did you say?
Our headquarters is in Hoboken, New Jersey. Yep. Okay.
So we have a site in Edison, New Jersey.
Sure.
So if you have any sore throat not at your house with your girls, it's 5 and up is our ages, but that's one of our good sites that we're starting up.
So when you say you have a brick and mortar, talk to me about that.
Well, we have 18 sites. So we have a physician group that have signed on as the clinical site. So we have a principal investigator there. And then there's 2 coordinators. And if you were to come in with one of your, let's say your daughter was 5, or if you were to come into the office and they would ask you to enroll in the trial. And if you wanted to, you would consent, you would go into a room, collect your own sample, run the test. And then the care provider would come in, run the test, or collect the sample along with the sample for a culture, and then run the test. And then that's really that's our study.
Got it. Wow. So they're using your test and then they're using another traditional test and matching them up.
Correct. Yeah.
Got it.
And our per diem is $100. And then the child gets a little toy. And then if you're negative, you go about your day. If you are positive, you will get a prescription, whatever your care provider prescribes you. But then we do follow up in 24 hours. And if the culture is positive, then that care provider will get in touch with you.
Got it.
And that's the advantage, I think, of our mobile app that we're putting together, is having that opportunity to say, oh, Annalie is negative, but can I check in with you in 6 hours? And we're going to monitor those symptoms for you and check back with a text message. And how is she feeling? If the symptoms have increased, then take another test or bring her into the doctor. Or if they've subsided, then we'll be on our way. But the follow-up of culture is something that I recognized was really broken in our system, because if you go in and you take her on a Friday, they're not going to call you until Monday. And so she's going to have raging strep Saturday, Sunday. And with our app, and having an at-home test, you're going to be able to test again and then use telemedicine for a prescription.
Sure. So not only are you getting peace of mind, you have direct access to a provider, you have instant results, you're also helping the other kids in the neighborhood by not taking them down with you.
Oh, for sure. Yeah. Because kids, you give them some ibuprofen and Tylenol and they feel great, right? Like for a couple of hours, they can go run until they can't. And then strep is just like, you can smell it. They have stomach ache. They have a headache. Yeah. I think that we're really going to change healthcare in the area of strep. UTI, like I said, we are coming out with that diagnostic, and then vaginal pH. We are looking at like breast milk strips for alcohol, as well as nutritional value. Wow. And then even further down, we're looking at some areas in women's health that we would have our own proprietary diagnostic that would be first of its kind. And that's more on our innovation work stream that we're working on.
Well, I can tell you, I will definitely be connecting my wife with Checkable Health. And
Awesome.
when your tests are on the market at the end of 2023, my daughter will be 4.5. So we'll probably start stockpiling the test. So when she's coming home from school sick, we'll be ready to test her.
Tell all your friends about it. And the school nurse too. The school nurse is a great person the school nurse loves the strep test. Every school nurse that we've interviewed is very excited that parents will have the opportunity to keep their kids home when they get a positive test.
That makes a lot of sense. Empowering the moms to do a little bit of what the nurse is doing, but in a much more efficient manner.
Yeah. We say empowering consumers to make clinical evidence-based decisions from the comforts of home.
Wow.
Yeah.
I love it. I love what you guys are doing. I think you're going to make a big wave in the testing market, supplement market. I think your branding's amazing. You did a great job with the look and feel of the brand, and I'm sure the products are just as excellent.
Thank you so much, Elliot. We have a small but mighty team, very passionate about helping all of you. So I really appreciate that.
I can tell. So kudos to you and your team. Thank you for your time so much. We really appreciated chatting with you today, Patty, and learning more about Checkable Health. Continue disrupting the industry, and we'll check in with you in a few months to see what's the latest products and what's happening with Checkable.
I would welcome that. Thank you, Elliot.
Good luck on your pitch today.
Thank you.
Have a wonderful day.
You too. Take care.
Bye-bye.
Bye-bye.